Health is a crucial issue for minority and indigenous communities because the right to health is the most fundamental human right. It is, after all, the right to survive. The right to health is a precondition for and the result of all other human rights. MRG knows all too well through our work that minority and indigenous communities often are marginalized from all aspects of life in their countries. And so we felt it was important to bring a minorities and indigenous perspective to the right to health. In addition, in terms of timing, the international community is gathering just now to debate the results of the Millennium Development Goals and to look forward and possibly develop a new framework for after 2015. Now, the MDGs have resulted in much that is good, but one of the fundamental flaws with them has been the lack of a rights or equity perspective. And so we hope that our volume can bring attention to the issue of minorities and indigenous peoples and the right to health, and also be used as an advocacy tool by their communities. Key findings include that minorities and indigenous peoples around the world suffer far worse health outcomes than majorities. And it is this, that it is a global issue. That is the very key finding of the report. So, for example, in Guatemala, indigenous children suffer approximately 20% higher malnutrition than majority communities. In Europe, Roma communities are disproportionately have less access to vaccines than majorities. Their children suffer from malnutrition, and there are higher infant mortality rates amongst Roma than amongst majorities. There are numerous health trends that are of concern to minority and indigenous communities. One very clear and disturbing health trend is to do with maternal mortality rates. So, for instance, in Balochistan in Pakistan, maternal mortality rates are approximately 3 times higher than national average. Another key concern is child health. So, for instance, with the Baka community in the Democratic Republic of Congo, children suffer 5 times higher measles mortality rates than the majority communities who live around them. Similarly, with regard to mental health, we see across the globe a real mental health crisis amongst minorities and indigenous communities. The suicide rate of adolescents in certain Native American communities in the United States and amongst certain religious minority communities in Iraq are much higher than amongst majorities. Health outcomes for minorities and indigenous peoples can be addressed in various ways. One clear trend I wish to underscore is that there's a very clear connection between minority and indigenous exclusion, poverty, and access to health. So we see, for example, that user fees, whether we're talking about indigenous communities in Vietnam or Roma communities in Europe, are a very critical problem and can exclude many members of minority and indigenous communities from accessing the health care that they need. Similarly, governments have a tendency not to invest in minority and indigenous communities. And so members of those communities have to travel very far distances in order to get the health care that they need. And just that travel, the cost of that travel, may prevent them from doing so. So what governments need to do is ensure that user fees are kept at a minimum, if at all, in order to make sure that healthcare is accessible to all. Moreover, governments need to invest further in infrastructure, bring healthcare clinics to minority and indigenous communities so they do not need to travel as far as they do in many countries. A further barrier is language. We've seen, for example, in such cases as Tanzania, also in Papua New Guinea, that language may prevent knowledge and understanding about healthcare issues. For example, HIV/AIDS prevention. In Tanzania, for example, HIV/AIDS prevention campaigns were only disseminated in Swahili, and so therefore pastoralist communities were not able to get the vital information that they needed. And so public healthcare information has to be disseminated in languages and in ways that are relevant to minority and indigenous communities. I'd like to emphasize as well the question of cultural sensitivity. Many healthcare practitioners lack an understanding for the holistic viewpoint that many minority and indigenous communities have with regard to health, whereby there is an intrinsic link between the individual's health and that of a community as well as the environment around them. Cultural sensitivity is particularly important with regard to maternal health. We've heard from many communities that they feel that public healthcare professionals, doctors, nurses, bring a very westernized approach to maternal health care. And so women at risk who may be in need of delivering their babies in hospitals may feel prevented from doing so because they feel that the environments will not be particularly receptive or welcoming to them. And of course, this adds to the risk that they may be facing. We've also seen positive examples where communities have gathered together and addressed healthcare issues in ways that are appropriate to them. I'd like to, for example, point to San communities in Namibia. Now, San communities tend to be on the move and move home quite frequently. And this has been a problem with regard to drug-resistant tuberculosis, in that patients, those who are suffering from tuberculosis, have not been able to complete their drug treatment programs. And so some communities have gathered together and created a system whereby families are trained in how to administer the drugs to those who are sick with tuberculosis. And they've been able to tackle themselves this particular issue of drug-resistant tuberculosis.